Have you ever wondered how a German princess became one of the most influential figures in Russian history, particularly in the field of public health? Picture this. A young woman, Catherine the Great, born and raised in Germany, is catapulted onto the Russian throne in a whirlwind of political intrigue. Her reign, which spanned over 3 decades in the second half of the 18th century, is marked by a significant question. How, in a time when medical knowledge was limited and healthcare infrastructure virtually non-existent, did Catherine manage to revolutionize Russia's medical landscape? Under her leadership, Russia saw a surge in the establishment of hospitals, clinics, and research labs. Her commitment to public health was not just a passing fancy, but a dedicated effort that changed the lives of her subjects and formed the bedrock of modern healthcare systems. So, how did this transformation come about? Let's delve deeper into this remarkable journey that transformed healthcare in Russia. Born Sophia Augusta Frederica, Catherine had a vision for Russia that encompassed more than just politics. Growing up in a relatively modest German family, young Sophia was thrust into the world of Russian politics when she married the future Tsar Peter III at the tender age of 16. She quickly adopted the name Catherine and embraced her new home, but she was not content to be a mere figurehead. Catherine had a vision for Russia, a vision that extended beyond the gilded halls of the palace, beyond the intricate dance of politics, and into the heart of the Russian society. From her early years, Catherine showed an interest in public health that was both personal and pragmatic. She understood that a healthy population was a productive population, and she set out to transform Russia's medical landscape. Her initial efforts were modest, focusing on the establishment of small clinics in the cities and villages that dotted the vast Russian landscape. But Catherine was not one to rest on her laurels. She recognized the need for a more systematic approach to healthcare, and she started to invest in hospitals. These were not just places of healing, but also centers of medical research and innovation. Catherine's hospitals were designed to be more than just a place to treat illness. They were to be laboratories of learning, where doctors could hone their skills and contribute to the advancement of medical science. Of course, these initiatives were not without challenges. There were those who questioned the need for such investment, who saw it as an unnecessary expense. But Catherine was undeterred. She saw the value not just in improving the health of her subjects, but also in laying the foundation for a modern healthcare system that could serve Russia long after her reign. In the years to follow, Catherine would continue to champion public health, investing in research and infrastructure, and pushing for medical innovation. Her commitment to this cause was unwavering, and it would leave an indelible mark on Russia. This was just the beginning of her impact on Russia's healthcare system. Once Catherine took the throne, her dedication to public health became evident. As Empress of Russia, Catherine the Great was not just a ruler, she was a visionary, one who saw the power of medicine and healthcare in transforming the lives of her subjects. Her commitment to public health was not mere lip service. She put her money where her mouth was, funding the establishment of hospitals, clinics, and research labs across the length and breadth of Russia. These were not ordinary buildings, they were the pillars of her healthcare empire, places where diseases were studied, cures were discovered, and lives were saved. But buildings alone do not make a healthcare system. It was the people within those buildings that brought them to life. Recognizing this, Catherine invited foreign doctors to Russia, their expertise lending credibility and knowledge to her burgeoning medical institutions. These doctors brought with them the latest medical advancements from the West, elevating the standard of healthcare in Russia to rival that of the most advanced nations in Europe. Yet, Catherine knew that for her healthcare empire to have a lasting impact, it needed to be self-sustaining. So she did not stop at merely inviting foreign doctors. She also established medical schools, ensuring a steady supply of homegrown medical professionals. These schools were more than just institutions of learning. They were incubators of innovation, where the doctors of tomorrow were trained and where the seeds of medical breakthroughs were sown. Catherine's healthcare empire was not just about buildings and doctors, it was about creating a culture of health. It was about instilling the understanding that health is not a luxury, but a right. It was about showing that a nation's strength lies not just in its military might or economic power, but in the well-being of its citizens. These groundbreaking initiatives marked the dawn of a new era in Russian healthcare. And so Catherine's vision of a healthier Russia began to take shape, one hospital, one clinic, one research lab at a time. Catherine's reign ended in 1796, but her impact on Russian healthcare was far from over. The seeds she had sown in the form of hospitals, clinics, and research labs had begun to grow, changing the face of medicine and public health in Russia forever. One of the most profound effects was the significant increase in life expectancy. Prior to Catherine's healthcare initiatives, the average Russian could expect to live just 30 years. But within a generation of her reign, that figure had risen to 40. By the turn of the 19th century, it had climbed even higher, to 50. This extraordinary leap was a testament to the power of accessible and effective healthcare, a legacy of Catherine's forward-thinking approach. Reduced mortality rates were another marker of her enduring influence. Through the establishment of hospitals and clinics across the country, Catherine had made healthcare accessible for the first time to millions of Russians. They no longer had to endure illness in silence or succumb to diseases that could be treated or prevented. This access to healthcare led to a sharp decline in mortality rates, especially among infants and children, a group particularly vulnerable to disease and malnutrition. But perhaps the most enduring impact of Catherine's initiatives was the enhancement of medical research. The research labs she funded became the epicenters of medical innovation in Russia. They were the birthplaces of countless medical breakthroughs and inventions, each one contributing to the further improvement of public health. Even today, these labs continue to push the boundaries of medical science, their work a testament to Catherine's vision and commitment. The revolutionary impact of Catherine's healthcare initiatives cannot be underestimated. They transformed not just the health of the Russian people, but the very fabric of Russian society. They laid the foundation for modern healthcare systems not just in Russia, but around the world. Indeed, Catherine's healthcare revolution was a gift that kept on giving. Catherine's commitment to public health transformed Russia's medical landscape. As we delve deeper into her reign, we find a ruler who prioritized the welfare of her people. She understood that a healthy nation was a prosperous nation, and she worked tirelessly to lay the groundwork for what would become a modern healthcare system. Catherine's primary focus was on developing infrastructure. She funded the construction of hospitals, clinics, and research labs across the vast expanse of Russia. These establishments were not just buildings, they were beacons of hope, symbols of the Empress's dedication to her subjects' well-being. But Catherine's revolution didn't stop at bricks and mortar. She recognized the importance of education in healthcare. To this end, she established medical schools and training programs, raising a generation of physicians, nurses, and researchers. Her commitment to education ensured that these institutions were staffed with knowledgeable, skilled professionals who could provide the highest level of care. Catherine's vision extended beyond immediate healthcare needs. She foresaw the importance of research in advancing medical knowledge and improving treatments. She funded laboratories, encouraging scientists to push the boundaries of what was known and possible. This led to numerous discoveries and advancements, many of which are still in use today. Her efforts were not in vain. The impact of Catherine's healthcare revolution was profound. Mortality rates declined, life expectancy increased, and the overall health of the Russian population improved significantly. Her initiatives set a precedent for future rulers, who continued to build on her foundations. Catherine's legacy in healthcare is a testament to her forward-thinking approach and her deep concern for her subjects. Her reign marked a turning point in Russian history, ushering in an era of medical innovation and setting the stage for the development of modern healthcare systems. And so, a German princess became a Russian empress and left an indelible mark on the healthcare system of an entire nation.